your cases. And yes, and I say this is a contribution of Dr. Tabacelli. So they say, we know Dr. Tabacelli, I believe. We are ready? ¿Ya estamos en vivo? Okay, listo. Hola. So, good day, everybody. Sorry because we were very out. We were very offline of our channel because I had a lot of work outside of the country. So I'm really sorry. Today we have a patient with an Acalasia type 3. So we will do a poem. So the first thing that I do when I do poem is I need to measure, where's my cardia. So the cardia is here, is at 36 more or less, and then I need to go 2 centimeters below the cardia, so 38. From that I need to measure 10 centimeters. So 28 will be fine, and I will start to do my poem here. I will do posterior poem, and I want to say thank you for all the people that were connected and came to our live course, and the online live course, and all the support, and the companies that support us, especially to Pentax Medical Aure, to Microtech, and Boston Scientific, and Fuji. So Mariela, this is another publicity for you. Thank you for the support and for all these years together. So I will use now a needle, a special needle from Microtech. This is 3 millimeter needle, and I will use Blue Boost for start to doing my cushion to start my poem. Comienza. So you see, this is hyaluronic acid. I prefer to work with this. Okay, gracias. And then I will use the flush knife to do my tunnel. Okay. So it's very important to evaluate the patient before. It's very important to see if the patient have any kind of infection, because it changed everything. This is a very good tip that I can say to you. And now I will try to do my poem. I am with a lot of good friends from different part of the continent. Está bien, está funcionando. ¿Abierto? So I start to doing my incision, you can see here. And I like to inject well, because this is very important. And for starting, it's very important to make a good dissection, because if you don't do a good dissection of the submucosal, to go inside the tunnel is very difficult. So this is very important. This is the most important step, I believe. One of the most important steps for the poem. Okay? So now I will cut a little bit more. And I like to use the water to go inside, not the air. So I'm working with The new processor from Pentax Medical is the Inspira with the i10 series gastroscope. So let's see. Now I am dissecting just the submucosal with force quag effect 3. And now I need to see if I can go inside. So I didn't make a good dissection. So this is very important. That's why I cannot go inside. Right? When you try and you don't go inside, it's because of this. There is still a lot of submucosal that you need to make a good dissection. I try to make a good dissection from both areas, the left and the right, to this open really well. Now I went to my left, and now I am trying to go to my right. I am almost in. A little bit more torque. I'm in. Yes, I'm in. A little bit of epithelium here, but it's okay. So now I will change. I love to use spray coagulation, as you can see here. So now I will try to be in a good position. So now once you are inside, it's very important to have a good orientation. So now my muscle is down, my mucosa is up, right? So this is very important. You need to understand and be very well with a good orientation, at least, to avoid to make a damage. We don't want to make a damage. You don't want to make a damage of the mucosa. So now I am inside the tunnel. So I will start. We need to inject, okay? Always injecting. And once you inject, you need to use now I am cutting. So I'm dissecting using the sprite coagulation. I like to use sprite coagulation, at least with this value 3, because it's have more power. Second, I don't need to change to make a coagulation, so it makes a very good coagulation of the vessels, even big vessels, and it's a very good advantage. Very good. So now I'm injecting. So you make the dissection not just with the dissection. You need to understand that your cap, as the surgeons, we need to push a little bit, right? And then you can see you can advance more. In the same way that the surgeons make a dissection with the fingers, we use the scope and the cap to make a dissection of the tunnel, so you can go faster a little bit, right? But you need to avoid to do that when you have vessels. If you have vessels, you need to make a dissection, correct dissection, like I am doing here now. And it's very important to have a good opening of the tunnel, right? So you can see here, I am opening a little bit more this area. Because I need more space, right? So now I have already 5 centimeters. I need just 5 more centimeters. That is muscle, so I'm not worried about that. So now I advance, you see? Very well, you see very well the muscles down. I'm almost near to the cardia now, okay? So my tunnel probably I will finish in few more minutes, right? And you can see that it's very clean the way that I am working. I try to avoid bleedings. Bleedings, doesn't help too much, but it happens sometimes. But we can avoid it, right? So I'm opening more the tunnel because I know that I am near from the cardia and I need more space. That's why I am working and try to open a little bit the submucosa here, right? You see? Very slowly. Very good. I will inject now. So you see the muscles there? It is okay. You know, I'm not worried about that, because what we need to be worried is about the mucosa, not about the muscle. So it's important to have the muscle well, because I need to create the tunnel, right? But you can see here, right? I'm dissecting just the submucosa. Okay? Now I know that this is starting the cardia because of the vessel. The vessel's coming from the stomach now. So now I need to take care. And one of my second tip that I like to say to you today is, when I have this vessel, so if you need to change, you change by a aqua grasper, right? But in this case, I will not change. I go in very down to the muscle because this is coming from down, and then I will perform a good coagulation like this. You see, no more vessel, no bleeding. So I protect, you know, to don't do it from the up, because you have the mucosa, and I need to protect my mucosa. Okay, there is another vessel here, and I want to make the same, right? So this is like a very important step. I think it's a very good tip, right? You see there is a good vessel here, and now I dissect, right? Now it's okay. I make the coagulation. So you see that the tunnel is became very tight. So I need to open. Very good. I need to open very well. Okay, another tip is that you can use the water channel, the water jet from the scope. So in that way you can have a better dilation instead that using the air. ¿Qué pasa? Oh. Sorry, my boss was here looking me, Dr. Alcibar, so I was nervous because he's mad because I arrived too late today. But I need to go. I need to went to my physicians today, you know, my normal routine evaluations. So I need to cut here, you see. So we don't have to less like some areas, you see, with submucosal, because if not, will be difficult, right? Like here, you see, we need to cut here. ¿Verdad, Sadi? Aquí hay que cortar, siempre hay que cortar la submucosa, ¿ok? Ok. Poco más. Okay, ahora. So, as I mentioned, I like to use my water jet channel from the scope, because in that way I can open a little bit better. So I'm at the level of the cardia now. I'm just passing the cardia. Once I get there, I will be finished my tunnel. So third space is a really nice advantage. We learn a lot from third space for poem, right? Poem is a platform, but third space is complete change the mind and the way that we were thinking as physician about the patients and the GI tract and also about complications. So we learn from complications, and now we are applying this kind of experience in other areas as US. The other day I had to recover uh, twice a stent that was inside the cavity, and so I need to make a hole and close. So working with CO2, and it is because of this experience about point that sometimes we can perform a damage of the mucosa, and we know that we can close, and it will close soon. So as the surgeon, when they repair immediately, the body will not have suffering about something different, or the tissue will not suffering too much, and the patient can recover immediately. Okay, now, so I see a lot of vessels here. I don't know if you can see it, but there is a big vessel there, big artery, and now I need to try to avoid it, but you can see now better. It's just down, you see. ¿Sí ven el vaso? Ok, entonces el truco es irse al músculo y coagular ahí. I will make a coagulation here, you see? With force, and then finish. I don't need to change. I don't need to use a coag rasper. Some cases yes, but some cases not, okay? So this is one of the advantage of this, the way that I do it. Not all the physicians do a poem in the same way, okay? Some of them like to use, I saw my good friend Mohamed using, the new setting, precise dissection, and it's nice. I think have each one have his own way to work. I like to go faster because here they made me work a lot, so I need to do a lot of things, and the idea is to finish in a good way for the patient with security, but also with okay, you see now? Now, I think I am almost there in the stomach. I need to cut here. Oh my god. I'm trying to get the better position because I need to dissect here. Okay. Little difficult, but now I'm okay. Some kind of fibrosis here, okay? So it's fibrotic tissue here. That's why it's a little bit hard. So you can see very well how we are dissecting here. And I believe I'm in the stomach now. Right. So now I am exactly in the point that I need to be. And I will see now from the other side. I will dissect a little bit more here because this is fibrosis. So, right? So this is very important, huh? To have a good dissection here. You can see the vessel there, yeah? Big vessel, right? Oh my god. Now, you see? So I make just the spread coagulation and it's done. That's why I like it. We need to have care because at the beginning, when I was really near from the surface, from the mucosa, I make some holes. So that's why some people doesn't like. But when you arrive to really understand well how to use it, your sprite coagulation, you can go in this way faster, right? Very nice. Very good. Now, I will inject because now I want to see where I am from the other side. I think I'm done. Now, I will see where I am. Toma, limpiarlo. So we are here. You see? So I'm below the cardia now, okay? So this is a Acalasia type 3, and this kind of Acalasia, the discussion now is that is needs to be treated by POEM and not by hair myotomy. We have better results with POEM. So now we go inside. I'm okay. And now I will start to well, now I will start to make my myotomy. And maybe in a few minutes we will finish this poem. So I think I give you all the tips that I have in my mind, okay? But we need to learn from masters, right? Like Professor Inoue and my good friends from India. I like to do it a full thickness resection, always. The results are very good. There are one publication, I believe, from some from a team from United States that they say that the patient have more pain. I didn't see it. In my series, I never saw it. So I believe it's safe. So you can do it. This is a thickness muscle. One of the disadvantage from the flush knife is that the tip is not too big. But I think you have more control. Now, you see I do it the full thickness. And now we continue do it. It's a very, big steak. Huh? This is a tomahawk. The muscle is very thick. Okay, The other tip that I can give you is when I am starting in this area, sometimes we have vessels coming from down. What I do is a spray coagulation before cutting. You see? When I start to see some vessels. So in that way, my poem is clean and I can avoid bleedings from the muscle. Remember that the muscles have a lot of vessels, so the bleeding came from that area and could be very difficult sometimes uh, to stop the bleedings. So that's why I use spray coagulation. You see here, I try to avoid the big vessels, but sometimes it's difficult. So sometimes you don't know, sometimes you don't see. So now I'm cutting, 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 cut, 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 cut. Very good. You see, there are some vessels there. Spray coagulation, and then I cut. Very good. You see? Again, spray coagulation and cut. Very good. I like it. Perfect. You see? I do a spray coagulation. It's a preventive way of the bleeding, right? Surgeons do like that. ¿Cierto, doctora Sadi? Ustedes previenen el sangrado antes, ¿verdad? No dejamos que sangren. But I believe it bleeds less than a normal surgery, ¿ah? Sangra menos que una cirugía normal, ¿verdad? So you see there is a vessel there, right? So I am identifying that because I am using iScan 1. So you see, if I use spray coagulation was born not for endoscopy, it was born for liver surgeries. But I think it's a very good application overall in this kind of situations, in muscles that can have a lot of vessels coming from inside for the irrigation, and the muscles bleed a lot. You can see very well. Very good, right? Right? I'm cutting the muscle. Now I am almost there. I try to cut this. I think this is a big vessel behind. You see? I stop it, right? And now I'm cutting again, you see? Very good. Perfect. Very good. Okay, very very thick. Whoa, here. Now, perfect. So I finish. The tunnel is finished. I'm on 40 centimeters. Is perfect. No bleeding. Now I will flush a little bit, and I will close. So today I will use some clips from Microtech. Thank you. Yes, I will use the 16th. You see here is I start my myotomy, and it's 2 centimeters from my incision, and now it's open. You see, it's very good open. It's well open. So now I'm okay, and I will start to close. Okay, now. Okay, abre. So my assistant she's very very good because she's already trained here. I don't need to say how to put, but she knows what is the position that she needs to do it, right? Gira un poquito a tu derecha. A tu derecha, sí. Ok, cierra despacio. Ok, lo tiene, cierra. So I close, and the first clip is very important. It will help you to do in the other ones. So now you see very well. I will put the second clip. So this patient will stay just one night. Abre. Gira. No. Gira. Okay. Abre. Ahí. Very good. You see? She's very good, huh? Cierra. Cierra todo. It's the best technician that I saw in my life. It's the best technician, right? Ah, la mejor técnica, ¿no? Mejor que el... Sí, sí, sí. Largo. Dice el doctor Alcibar que es mejor que el antiguo que teníamos aquí que se fue. Ok, abre. Cierra. Cierra todo. So we finish, right? So we just used 3 clips. The hole is closed. Let me see very well. Yes, it's closed. Un clip más, dame. I will put 1 clip more here, in the middle. I believe it's closed. Ok, abre. Gira. Gira. No. Así lo quiero. Gira. Ok, abre. So, very good. Abre. Abre. Perfecto. Okay. Cierra. 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 No importa. Abre. No importa, no importa. Abre. Cierra. Sí. Ok, abre. Ahí cierra. 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 Perfect. Okay. So we finish. Good close. Okay, we will pass another case, so stay connected. Right? I finish.